Hi, I'm Dr. Nick Walters, and I work at Mission Hospital, and I'd like to talk to you today about influenza. Well, I want to talk to you today about influenza. Just to let you know, I'm a medicine doctor at Mission Hospital, and I take care of quite a few patients with influenza. Well, first, some people ask, well, what is influenza? Influenza, sometimes called the flu, is a virus infection. It affects the respiratory tract, which means it can affect the nose, the mouth, the throat, the trachea, the bronchi, down into the lungs. It's caused by three different viruses, or three different groups of viruses: influenza A, B, and C. Now, C normally doesn't cause any serious infections, so because of that, we usually concentrate on influenza A and B because those are the major causes of illness. A and B are a little bit different from each other in that influenza A can affect both people and animals. That's why you may have heard of birds getting flu or pigs getting flu. That's influenza A. Influenza B only affects humans. Now, usually it comes as seasons. Here in Thailand, influenza often comes with the rainy season and sometimes during the cold time of year as well. However, occasionally there are pandemics where the influenza will spread throughout the world. And usually these viruses we give a name to. For example, we heard of swine flu. Well, doctors use a different name for them. It's based on the biology, but we also have names for them. Doctors, we call them, for example, H1N1, which, by the way, is the swine flu that had its big outbreak in the year 2009 and spread around the world, and is continuing to occur worldwide. I want to tell you a little bit more about influenza and that how do you get it? Well, you can get influenza infection by inhaling droplets. So if someone comes and they cough and those droplets go into the room, they're microscopic, you won't see them. But if you breathe them in or inhale them, or if the droplets settle on a desk or something that you touch and you rub your nose, your eyes, touch your mouth, that's how you can get influenza as well. It's very contagious. Well, why is influenza even important? Yes, it causes some fever and other things, but why should we worry about it? Well, influenza can have complications, and these complications can be dangerous at times. The common complications we see with influenza are things like sinus infections, ear infections, bronchitis, pneumonia, which can be very dangerous. In fact, so dangerous that every year worldwide between 500 and 600,000 people die from influenza. That's one of the reasons why I want to tell you about this virus and what we can do about it and how we can prevent you from getting it. Because we as doctors would much rather prevent it than to treat it. And these 500 to 600,000 deaths are preventable. Now, what are the symptoms of influenza? Usually we see fever, chills, body aches, throat pain, which can be quite severe to the point where some people feel like they're getting a throat infection. Cough is very common. A blocked nose, not so much of a running nose with this. How do we diagnose influenza? Influenza is usually diagnosed by taking a swab. It's like a cotton bud. We put it in the nose and we take some of that mucus and we send it to the lab. And that test usually takes about an hour to get the results back, and it will tell us whether or not you have influenza. Now, this test, if we do it within the first 24 hours of being sick, we may not find the virus, even if you're sick with it. So usually the test is more accurate if you've been sick for 24 hours. But even still, the test is not 100% accurate. It's about 85% accurate. It means about 15% of the people who have this test done and have influenza, we won't be able to find it on the test. So we look at the other symptoms as well and the risk factors. For people who do have influenza, how we treat it depends on the person. So for example, if the person is high risk for having the complications that we talked about, bronchitis, pneumonia, dangerous complications, which I'll get to in a minute as far as the risk factors, but if you're in a high-risk group, we usually treat it with an antiviral medicine. We also give medicine to decrease the symptoms. So if you have fever, we can give medicine to lower the fever. If you have cough, we can give you something to quiet the cough. If you have phlegm or sputum, we can give you medicine to help that come out more easily rather than staying inside. So in addition to the antivirus medicine, we give medicine to make you feel better. But about the antivirus medicine, it's only effective if you get it and begin taking it within 48 to 72 hours, 2 to 3 days, the first 2 to 3 days after you begin to get sick. If it's been more than 3 days that you've been sick, it's probably not going to help you. Because this antivirus medicine does not kill influenza virus. So it's different than an antibiotic, where you take an antibiotic and most antibiotics, when you take them, kill the bacteria. Well, antibiotics don't work for influenza. You have to have an antiviral. Antibiotics only work for bacteria. Antivirals work for viruses, and influenza is a kind of virus infection. But how it works is it doesn't kill the virus, it prevents reproduction of the virus. So if you've got an infection, it starts up in your nose. If you take the medicine right away before it moves into your chest, then it keeps you from getting as sick and also shortens the length of the illness. So it doesn't cure the problem. Your body's own immune system cures the problem. And this is where it's very important, because people who have immune problems where their bodies can't fight this infection off are more likely to have complications. An example, someone with HIV infection with a suppressed immunity, or diabetes, or cancer, or is taking medicine to suppress their immune system. Those people are much more likely to get more severe cases and have the complications of influenza. Well, how can you prevent it from spreading? The best way of preventing influenza from spreading is good hand washing and avoiding people who, in crowds, especially during influenza season, which here in Thailand, as I mentioned before, is often during the rainy season. So avoiding places where lots of people are going at the same time. If you are getting sick, if you have a cough or a sneeze, it's actually better not to cough in your hand. Use your elbow and cough into your elbow, or sneeze into your elbow. The reason for that is you cough into your hands and then touch a telephone or touch something else, and someone else uses that phone or touches that, rubs their nose, they can get influenza. So we want you to not get sick, and so good hand washing, stay away from crowds, try to protect your immune system by getting enough rest and having a healthy diet. Well, how can we prevent influenza infection? This is especially important because it's better to prevent than to treat. The best way of preventing influenza infection is by an influenza vaccine. If you're going to be around people with influenza, the best way is not to be around anyone with influenza. The problem is you may not know when you're around people with influenza. They may look like they're fine, but they're actually sick with the infection. So because of that, the flu vaccine helps to prevent it. Now, one of the problems with influenza is there are many different types of influenza. As I mentioned before, there are 3 groups, but especially A and B, those two have many different types of virus. Every year the virus mutates and changes, and because of that our bodies don't have immunity to the new change, the new mutation, and we only have protection against the things we've been vaccinated for or the things we've already had. And so because of that, that's the virus's way of trying to reinfect humans by mutating to another form that we don't have immunity to. But the vaccine, what happens is usually about 3 or 4 different strains of influenza virus will spread per year, and then that may change the following year and the year after that. So because of that, what they do with the vaccine is at the very beginning of the influenza season, they look at the kinds of viruses that are beginning to increase, and then they make a vaccine against those 3 or 4 viruses that are most likely to cause influenza during that influenza season. Then we give that vaccine to you, and that will boost your immune system so you can be protected against those 3 or 4 strains. It doesn't protect against all the other strains that are less common, and it's unfortunately not 100% effective in preventing influenza. In fact, it's probably about 65% effective. Now, I know that doesn't sound very good, but that's much better than 0% efficacy. And so we do recommend getting this vaccine yearly to allow your body to be adjusted to the new strains that are beginning to spread each year. Well, with this, there are some concerns that people have about vaccines. Are they going to work for you, or are they safe, or other things? And so because of this, in this talk, we've asked people to send in questions. And so what I like to do is there's a list of questions here. I'm going to go through some of the questions here, and as you have questions, you can send those in as well.